Balance system is an outcomes framework looking at outcomes for children, speech, language and communication development, which focuses on ensuring that any support for children and families is about their needs and what's going to make a difference to them on a day-to-day basis. It involves bringing everybody together who might be involved in that child or young person's life to come together and have a shared vision of what they're trying to achieve that is based on the focus and priorities for that child and their family.
So we strategically came together with partners from across early years, from our health visiting service, from public health nursing, from our speech and language colleagues, and we really looked at where were we and where were our gaps. We looked at the strengths that each setting had and the areas that we were offering to families, and then we mapped it all out and used that system to then support our delivery plan moving forward.
So I've been out to all of the early years settings that are within Torbay and carried out assessment with them, that we've looked at all of their areas of provision and we've identified their weakness, whether it be in their own practice or their support with public health.
The balance system is formed of 5 core strands. The first strand is family support. The second strand is enabling environments. The third strand is the workforce. The fourth strand is identification. And the fifth and final strand is intervention. And it's really important that all of the provision comes together, ensuring all of the 5 strands are considered at once. It's thinking about how to make services easy to access, being where children and families are in family hubs, libraries and other community settings, through support such as drop-ins, where families can come on a regular basis to seek support, advice and guidance, but also access further assessment and support or intervention.
So the easy access drop-in sessions, they are open to preschool children, so children under 5, and they are appointments out in our community. The easy access drop-ins is that first step on that journey. The good thing about the drop-ins is they are available for all and you can come back again. So we are also running a link therapy model with our local schools, and what the link therapist aims to do is build that relationship with them so that we can help them to identify speech and language needs in their children, but also look at what they're doing really well. We'll be able to support them to identify the children with the highest need, and we'll be able to support them to find the most appropriate intervention for them.
We're really excited about the prospect of link therapists within our school. That person then is able to assess children on entry and to find out what areas they need help with, what our teaching assistants and teachers should be doing to support them.
So when looking at the outcomes for the children and young people, we will be using the balance systems tiered approach. It's tiered into universal, targeted and specialist. Each child will present very differently, so where we offer the support will be based on their profile, but there's lots of support available.
So where services have implemented the balance system through the lens of the core delivery principles, they have provided an easy to access service which is based on a drop-in in family hub. This has enabled some services to go from waiting lists of more than 12 months to having no waiting list within 4 months.
Our waiting lists have reduced in the areas doing the easy access drop-ins, so we are identifying those children's needs a lot earlier.
My hope is that actually what we will see is fewer children needing to be referred to speech and language therapy externally. It's going to close gaps, which means they're going to be able to learn in their English lessons, in their maths lessons.
We are really delighted that this partnership is now at that implementation stage for Torbay and Devon.